President Trump appears to be backing off the hard line he took earlier this week on vaping and e-cigarettes. So last night, the president tweeted, "While I like the vaping alternative to cigarettes, we need to make sure this alternative is safe for all. Let's get counterfeits off the market and keep young children from vaping."
On Wednesday, Trump said he wanted to ban all flavored e-cigarettes, including mint and menthol, and that the FDA was working on plans to do just that.
Well, the CDC on Thursday said there are now 380 confirmed cases of lung disease associated with e-cigarette use or vaping. In response, the CDC, American Medical Association, and other major medical organizations are telling people to not use the devices, at least until they can determine what is causing the disease.
And we've learned about a teenager in Illinois who now has the lungs of a 70-year-old from vaping for over a year. Is this proof that vaping may be worse for your health than cigarettes? Joining me now is Dr. Vin Gupta. He is a critical care physician with the U.S. Air Force Medical Corps. Doctor, first off, I just want to get your reaction to what the president has been tweeting. And it sounds like he's obviously softening his tone on this issue that he actually came out strong against with this ban on flavored e-cigarettes. And he's suggesting that vaping is safer than traditional cigarettes. Do you agree with that?
So I think the president is on to something when he's suggesting that vaping can have a role in American public health. What we do know about vaping is that amongst people that are addicted to conventional cigarettes, those who have been smoking cigarettes for years and years, we know that vaping potentially could be more effective to help people quit cigarettes, conventional cigarettes, than other things like nicotines or nicotine lozenges, nicotine patches. Having said that, the way that we are currently regulating, the way that we're currently thinking about safety of e-cigarettes is unacceptable. The FDA has not reviewed a single e-cigarette on the marketplace for health or safety impacts. So we can't have it both ways right now. Potentially, could we in the future? I think that's an open discussion.
I mean, that to me is just astonishing. I mean, how is it that these products that can be damaging to your health, if there's nicotine in there, that could be damaging to your health, that's a fact. How could they not be regulated? I mean, what are the standards right now? Victor and I were just talking about this during the break. You can walk into any drugstore and get, or you can't get razors. Some of the shaving razors are locked away, yet you can get e-cigarettes much more easily.
Yeah, pretty much yes. It's shocking. To think that now we have over 400 cases of people with severe lung illness, probable or confirmed, 6 deaths likely to rise. We have a chronic epidemic of over 20% of high schoolers are using these flavored e-cigarettes nationwide. This is a problem across a range of levels. It's a public health emergency, and it's been enabled by our politics. Essentially what's happened is the vaping industry and their associated lobbying groups have lobbied the FDA, the Trump administration, to say, delay the rules that require you to assess health and safety impacts of these products. It's unacceptable. Wow. These should be reviewed before they go on to the marketplace.
You were talking about the popularity of these e-cigarettes, especially amongst the youth, amongst teens and high schools, and maybe even in some middle schools. And I was reading about how some teenagers are even sleeping with their e-cigarettes under their pillows because they're so addicted to it. As soon as they wake up, they need to take a few puffs. Tell us about the marketing, because I did read a government report that said I think 80% of teens who admitted to vaping said that they were attracted to e-cigarettes because of the flavors like mint and mango and what have you.
So if you're a youth between 12 and 17 and you use an e-cigarette, 97% of those youths use a flavored e-cigarette. 70% of these youths say that they started using these flavored e-cigarettes because they're flavored. They like cotton candy. They like the taste of it. The marketing strategies of Juul, of the vaping industry writ large, they know what they're doing. They're not naive. They know that kids like these types of flavored products. That's why 50% of their social media followers are youths. They know exactly what they're doing. This is big tobacco mutating its strategies from the 1960s to the modern age. It's effective. They need to stop doing what they're doing from an industry marketing standpoint. We need to ban at the federal level all flavored e-cigarettes, and we need to do that now.
So you think that ban will be effective, but what about the youth who are already addicted to e-cigarettes? What happens to them?
Well, I think you're raising a point that myself as a pulmonologist, everybody in the public health community is worried about that exact fact. This is a chronic epidemic, and you nailed it. What we're having here is individuals that are addicted to e-cigarettes. 20% of all high schoolers. This is a gateway drug because they are now addicted to nicotine, to conventional cigarettes. It's a huge problem. And so that's a larger question that we in the public health community have to really wrestle with.
Glad to have you on, Dr. Vin Gupta. Thank you for your time.
Thank you for having me.